Hello and welcome back to our series of osteology of upper limb. Today we are going to learn about the osteology of radius. In general, radius is a lateral bone of forearm and is a typical long bone. Its location is between the elbow joint above and the wrist joint below. The wrist joint is also known as the radiocarpal joint. Now we'll talk about the site determination of the radius. The head is always located medially and is considered as the upper end. Then the lower end is expanded and consists of two surfaces, the anterior surface and the posterior surface. The anterior surface is concave and smooth, whereas the posterior surface is rough and consists of grooves and tubercle. The medial border of the radius is sharp and the lateral surface is convex. Now we'll talk about the parts of the radius. We'll learn it in three parts, the upper end, the shaft and the lower end. To talk about the upper end is divided into the head of the radius, neck and radial tuberosity. To talk about the upper surface of the head articulates with the capitulum of humerus to form the radiohumeral joint, whereas the medial surface articulates with the radial notch of ulnar head to form the superior radioulnar joint. This is neck. Then about the radial tuberosity. The radial tuberosity always lies medially and its anterior surface is smooth whereas the posterior surface is rough. Now to talk about the shaft. The shaft has three borders and three surfaces. The anterior border, the medial border, the posterior border. And about the surfaces, the anterior surface, lateral surface and the posterior surface. Here are the three views, the anterior view, the posterior view and the lateral view. The one highlighted in red is the anterior border. This one is the medial border. Then comes the posterior border on the posterior view. Then about the surfaces, the anterior surface is located between the anterior and the medial border, whereas the lateral surface is located between the posterior and the anterior border. Lastly, the posterior surface that is located between the posterior and the medial border. Then we have the lower end. Lower end is expanded and large. Laterally, we have styloid process of radius. Medially, we have ulnar notch which articulates with the head of the ulna to form the inferior radioulnar joint. Then posteriorly, we have grooves and a dorsal tubercle. This portion is very rough due to presence of ridges and grooves. Then anteriorly, the surface is smooth and concave. Lastly, we have the inferior surface. On the inferior surface, there are two articular facets present for articulation with the two carpal bones. There is a triangular facet for scaphoid bone and a quadrangular facet for articulation with the lunate bone.
Now guys, I am going to talk about ossification of radius. Radius has two ossification center, one primary ossification center which is located at shaft of radius or diaphysis part, and it will appear at 7th week of intrauterine life, or we can say fetal development. Then moving to the secondary ossification point. The first secondary ossification point is at proximal part of radius. It will appear at 4 to 5th year of age, and then the last point, which is located at distal part of radius, and it will appear at 2 to 3 years of age. And the complete fusion of this ossification center will take place at 18 to 19 years of age. Then clinical point, the fracture of radius. In this we will talk about basically two most common and important fractures. First one is Colles fracture and second Smith fracture. The Colles fracture, also known as table fork deformity. Now talking about this fracture, here you can see that the radius is displaced downward. The downward displacement of radius is called as Colles fracture. In second X-ray, you can see there is a fracture at this point. The displacement is upward displacement. This fracture is known as Smith fracture. These two fractures are basically important for NEET, PG, and FMG exam. They will ask, simply they will give image, and they will ask you that identify the name of X-ray or the fracture name. Now we will talk about recent year questions or PYQs. From one part, only one question was asked, which was asked in NEET PG 2019. In this question, they gave X-ray and ask about this arrow. So this is the humerus, this is the radius, and this is the ulna. So basically, this is the proximal part of radius, which is called as head. So radial head is the correct answer.
Talking about ulna, here we have the upper end, the shaft, the lower end. This here is the ulnar diagram. So, it is a typical long bone. It develops from cartilaginous ossification or say enchondral ossification. That means it develops from the hyaline cartilage. Talking about its location, it is the medial bone of forearm. Now you know medial means closer to the center of body. And above the ulna we have the elbow joint and below we have the wrist joint. Talking about its side determination, well, the upper end, how will you define upper end? Well, it is large, hook like, say trochlear notch. Well, its concavity is directed forward, whereas the lower end is smaller and carries head and styloid process. Talking about its lateral border or say the interosseous border, it is sharp. Talking about its parts, we have the upper end, the shaft, the lower end. Well, upper end hook shaped as we have seen here. It has two processes, two notches, and two impressions. Impressions in the sense the muscular impression. Well, the two processes are conoid process, olecranon process, two notches are trochlear notch, radial notch, two muscular impressions. The first one is the supinator fossa and crest, and second one is the ulnar tuberosity. Looking more in this upper end, we have, as we have discussed, this one right here is the olecranon process. Well, olecranon process lodges on the olecranon fossa, which is on the posterior side of the humerus, as we have learned. Then we have here the coronoid process. Well, the coronoid process lodges, like anterior part of coronoid process lodges into the coronoid fossa, which is in the humerus. Here we have the ulnar tuberosity. See this part here. This part is the trochlear notch.
Did the upper end. Now about the lower end. The lower end is smaller than the upper end and is formed of head and styloid process. So the head is rounded, directed laterally and can be felt subcutaneously under the skin in the pronation process. Secondly, the styloid process. The styloid process projects downwards from the posterior medial part of the head and it can be felt subcutaneously in the supination position. Now let's talk about the shaft of the ulna. The shaft of the ulna is thick above but it tapers towards the lower end. Its upper 3/4 part is triangular in cross section. This shaft of ulna consists of three borders and three surfaces. The three borders include the interosseous border, the anterior border, and the posterior border. To talk about the interosseous border, it is sharp and directed laterally. It gives attachment to the interosseous membrane and its upper end is in continuous with the supinator crest. Now, to talk about the anterior border is rounded and starts above the lower end of the medial border of the coronoid process and it ends below at the base of the styloid process. Then for the posterior border is prominent and starts above at the apex of the posterior surface of the olecranon. Lastly, the surfaces. There are three surfaces: the anterior surface, the medial surface, and the posterior surface. The anterior surface is the one that is located between the anterior and the interosseous border. Lastly, the posterior surface. The posterior surface is located between the posterior and the interosseous border. Now we have the ossification centers of the ulna. Ulna ossifies in cartilage, that is enchondral ossification, and it happens from three centers. First one primary center is located at the shaft, appears at the 8th week of the intrauterine life. Secondly, there are two secondary centers. The first center is located at the lower end, which appears at the 6th year. Then the another secondary center is located at the upper end on the olecranon process and it appears at the age of ninth or 10th year.